Hi, I'm Dr. Gerald Deas. Welcome to Health Center from Downstate Medical Center. Being a doctor, one thing part of my whole treatment of a patient oftentimes is writing a prescription. I try not to give them more prescriptions that they need. I try to get it clearer to them while I talk with them sometimes, which makes a difference. You can write a prescription. Sometimes I say, you need a prescription for love. You know, not just a drug. Sometimes you need one for love or getting along with other people. So I'll even write that on my on my prescription blank. And they say, well, what does this mean? Can I take it to the drugstore? You don't even have to, I tell them you don't have to pay for it. All you have to do is start acting out what I'm putting on this prescription for you. But oftentimes it's a prescription that has a medication on it. Now, medications are dangerous things. You know, in medical school, believe it or not, pharmacology is not a subject that's taught in such detail that you can know all of the pharmacology after you get out of medical school. Nowhere near it. And so consequently, doctors don't get enough descriptive and lectures and things like that on pharmacology. A pharmacist, on the other hand, it's a 7-year program. Today, a pharmacist, the average pharmacist gets a PhD in pharmacy. And when you send that prescription to that pharmacist can read that prescription and in their head tell you all the things that can interact with that prescription that you just wrote that you didn't know that had that kind of adverse effect if you mixed, if you take that prescription. So you have to have so much respect for the pharmacist today. In fact, oftentimes I had to call the pharmacist and ask them, I'm giving this patient these 2 drugs, is there any interaction? And they would get right back to me and they say, yes, well, it can cause this, this, and this. Well, why should I cause a disease by trying to prevent a disease or help a disease as such? Because drugs are drugs. I don't care if you're taking aspirin. It can interact with so many other things that you're taking in your prescription. I just had a thing the other day where a person was having swelling of the legs and came to me as such, and they didn't realize that taking some of these non-steroidal things like Motrin and these kind of drugs off the shelf can give you edema of the legs as such, swelling of the legs. Now, right away, if you didn't know that, you would say, well, it's due to her cardiac problem and this thing, we have to give her some more water pills and things like that. So sometimes pain pills and these other pills don't mix too cool together, you know. So today we're going to discuss some of these kind of things, aware how we control other drugs here, even in the hospital. There's a department that heads up all this kind of things, so from whether it be even alcoholism and things like this. Just taking a drink in the evening, taking your pills can have an effect upon the physiology of your body. So I want to welcome Lorraine Brooks here, who's head of this department. Lorraine, thanks so much for seeing us. And you know, it's interesting, just for a little of your background, because a lot of times folks just think, who are you? What are you talking about? A little of your background. How did you get involved in your thing? Even the story you told me.
Okay. I just told you a story off camera, so I'll tell you again. When I first took this job almost 20 years ago, I'm the director of the Employee Assistance Program. So part of my job is just to deal with people who work here who have various issues. It could be any kind of issues.
Right.
And one of my first clients was a gentleman who had a problem with alcohol.
Mm-hmm. Who worked here?
Who worked here. And he came to me and said, confessed to me that he drank over a quart of alcohol every day, quart of vodka. And I was shocked. At that time, I had never heard of anybody consuming that much alcohol. Mm-hmm. And he was very honest and very forthcoming, and he wanted treatment. He wanted to get help for this problem. Dr. Deas, this was my second client, literally the second person that I saw after I took this job. I had no idea what to tell him or how to help him.
Right, yes.
Fortunately, my instincts kind of kicked in, and I knew who to call, and I made some phone calls and got him into treatment, and he actually did very well.
Right.
But that experience kind of taught me that I didn't really know a lot about that particular topic, and I was scared that I would give this guy the wrong information, or that I would tell him inadvertently, tell him the wrong thing. So I went back to school right away, and I got a certificate in chemical dependency counseling. That was the first thing I did.
Right.
And then after that, I went back again, and I got a master's in public health. And my concentration was on addictive diseases.
Yes, right.
You'd be surprised. Well, you wouldn't be surprised, but I think the average person might be surprised at how pervasive it is. It's not just the people that you see on the street or the people that look a little disheveled or kind of weird.
Sure.
It's professionals, it's nurses, it's physicians, it's teachers, it's pharmacists, it's, you know, it can be anybody, it can be any one of us.
Of course. And you know, it's really interesting. I had my bag stolen once out of the back of my car. They actually broke my lock. And they took my prized bag. I was an old bag that somebody gave me. It's an antique bag I made my house calls with, you know. And so they got a hold of my prescription blanks in my bag, you know. And drugstores started calling me up and asking me, did I write this amount of 100 pills for this or that and so forth? I said no, and they said, well, here's your prescription. But it wasn't my signature on that prescription, but anybody can fake your thing. And so that's the difficulty that we have with prescription. So they started having another program where they, especially on narcotics, or even something like with Tylenol, maybe number 3 with a lot of codeine and things like this, where when you wrote a prescription for that, you kept a copy of it in the book, the pharmacist got a copy, and they sent one copy to Albany to be registered of this patient. Now, that, to me, seemingly was a good program from the control, but you'd be surprised how many politicians and people are against that through the pressure maybe of drug companies, in a sense, not having to have all this complication when you wrote a simple drug that had addictive qualities to it.
Not a simple drug, though. That's
right.
the point.
That's right.
It has addictive qualities. That's exactly
right. But continue on with your, after you got all your training and then had this, all these folks approaching you now to get information about their drinking or this thing and that thing. Maybe, what else were you doing in your department?
Well, you know, I discovered after going back to school that it's not just alcohol, it's not just legal prescriptions. You know, it's illicit drugs, it's cocaine, it's things that you buy on the street. And it's also, a person can also have a prescription, have a legitimate prescription that was written by a doctor for a legitimate problem that they have, and still develop a problem. You know, sometimes we think that, well, Dr. Deas wrote me that prescription. You know, I went to the doctor and I told him I have this pain in my back, and he gave me a prescription for, I don't know, Demerol, Tylenol, you know. And he said, here, take this 3 times a day. It'll help your back pain. Well, I took it 3 times a day, and it made my back pain feel pretty good. So maybe if I take it 4 times a day, I'll feel even better. You know, or I took it 3 times a day and I still had a little, so maybe I'll take it 4 times tomorrow. And it's just that simple. And then the next thing you know, you're taking it 8 times a day. You're taking it 12 times a day.
And on the bottle it says specifically
4 times a day or 3 times a day.
3 times a day,
So, but you might think, well, here's my prescription. It has my name on it. My doctor wrote this prescription for me. I have a legitimate problem. So I'm not abusing this, you know, or I'm not going to get addicted to this. This is something that I have a right to be taking. But you can cross that line between taking it for the right reasons and taking it for the wrong reasons. That could be a problem.
Well, I know oftentimes anything that has codeine attached to it, you know, will act much better than just the plain pill itself, so they'll attach codeine onto it. You know.
Codeine used to be, remember, I used to use it for coughs. I'm sure you remember, it used to be in cough syrup, right? And I remember when I was a little girl, Cheracol cough syrup. I don't know if you have to remember that.
A thick red cherry.
The thick red cherry flavor, And anytime we had a cold or a cough, we would get Cheracol D. And the D meant that it had the codeine in it, right? And it was great stuff, and it cured. We used to use it all the time. I remember my parents giving me Cheracol. Now they make Cheracol, of course, without the codeine. But how old was I? 6, 7, 8, 10. You know, and you can develop a dependence at any age.
Well, listen, you know, I've had patients in clinics and things like that. When the baby cried too much at night, give them a half a teaspoon of charcoal,
Yeah.
or some of these things.
Or alcohol on the gums when they're teething.
You're right,
you know,
surely.
or rum,
You know,
or
right.
something on the gum.
But addictive drugs, even to a baby, you know what I mean? And thinking that it'll quiet them down and let them go to sleep.
Well, that's the thing. Drugs work.
That's right, surely.
See, that's why people take them, because the psychoactive drugs, the drugs
yes.
that act on your brain,
Right.
and psychoactive drugs cause changes in your thought, your mood, and your behavior.
Oh, surely.
That's what they do. So when people take them, that's exactly why they're taking them. They want to change their thoughts, their moods, and their behavior,
Surely.
and of course they work.
Right.
So if you're gonna, you want to change a baby's behavior, the baby's crying and he's
Right.
teething, and you put a couple of drops of whatever on the gum, and of course it changes
Teething,
the
of
baby's
course.
behavior.
Well,
because it acts on his brain. Yeah.
when I was in Japan, they had tea houses, and teas have different effects. In fact, there's a business that has a tea house where you can get all kinds of teas and things. Teas to make you sleepy, teas to wake you up.
They make teas out of opium. They make
Sure.
teas out of marijuana.
Sure, of course, and marijuana now being one of the trying to legalize thing right now in California. I think it's almost legalized. That's going to creep across right into your business here.
Absolutely.
And so they'll be drinking a tea, getting a high on a tea
right.
and so forth, and feeling quite good about it and things like this. But at the same time, you have to start knowing even that aspect of it.
When they first started with medical marijuana, you used to get a prescription for Marinol.
Yeah, that's right. Sure.
Right? You
That's
get a
right.
prescription for a Marinol tablet or capsule.
That's right.
Now they actually write prescriptions for the marijuana itself, for the plant, for the
plant.
leaf.
That's right. Yeah.
And you can take that prescription to a marijuana pharmacy
Sure.
and have it filled with the actual leaf that you smoke.
Right. And what even something more even common than marijuana, but has a definite effect upon your body, is caffeine. Now, with all the coffee houses, with all the different coffees, even the children now with the coffees and things that they're making them in
Lattes
and things like this.
chocolates,
This is going to offer a great problem with an employee here who's on medication and drinks 6 cups of coffee a day. One time I had a patient go in and her eyes was bugging out of her head and so forth, and she said she needed something for her nerves because she was very nervous. And I said, well, I went down the list of things. I said, well, how much coffee do you drink? She said 12 cups a day.
Ooh.
12 cups a day. And she needed something. Now, coffee, if you know the physiological side of it, depletes your body of a very important vitamin called thiamine, vitamin B1. In fact, even alcoholics get a thiamine deficiency, so when they detox them, thiamine goes in that IV fluids and things like this. But here you're sitting in a hospital where people are working here and they're taking all kind of medicines and things like this. I can understand how you have to know so much more than what you thought you knew at one time.
Yeah. And now they're even making soft drinks now. They have a soft drink a while ago called Jolt.
Oh, yes.
Jolt, I don't know if they still make it. But it had 10 times the caffeine that a regular Coke had. Or what is it? Red Bull.
Red Bull, sure.
People drink Red Bull, and they mix Red Bull now with vodka.
That's right. And young people are doing this.
Yeah.
You know what I mean?
So you got Red Bull that's a stimulant,
right? Of course.
And then you have the alcohol that's a depressant, and it's kind of confusing your central nervous system, and you don't know whether to be stimulated or depressed, and you get these crazy thoughts, and some people even have very adverse reactions, suicidal thoughts, and aggressive behavior, and it's not anything to really play around with, and these things are illegal. They're available. Excuse me. They're over the counter.
Surely.
You can go into any store and buy Red Bull. These 5-hour energy drinks now that they're advertising.
I just spoke on that.
Full of caffeine, full of sugar, full of all kinds of things that are psychoactive. They have an effect on the way your brain operates.
Right.
But I see it every day. And
well, the thing that with your job too, you're dealing with more than one person. You're dealing with a person who's employed here, but they're going to go home and interact with other people. And also, so therefore, you have to control what you're doing with them so they don't go and do something negative at home. So that's
and vice versa.
And vice versa.
Because even people who go home and abuse drugs outside of the workplace, and then they come here the next day, and they're still under the influence. Depends on the drug that you're taking and how long it stays in your system.
Right.
And,
Oh yes.
you know, you could go home at 8 o'clock at night and drink a bottle of vodka, say, for example,
sure.
which this gentleman did. You go home at 8 o'clock at night.
Right.
It takes you maybe 4 or 5 hours to consume that whole bottle of vodka. So by
Yeah.
midnight, 1 o'clock in the morning, you're still actively drinking. At 7 o'clock the next morning, when you get up to come to work, you're still under the influence of the alcohol that you drank the night before, even though you're not really feeling it, but it's still in your bloodstream.
Surely.
And people don't understand that.
Right.
You know, they don't understand how what they do at home
Yes.
has an effect on what they do here.
Well, you know, I
and
see.
vice versa.
Well, I know your activity in the hospital here is more than just even talking about drugs and things like that, because I know you're very active in spousal abuse and things like this. And this is all hooked up with what you're taking medication. Maybe you could talk a little bit about even spousal abuse and this type of thing that you are sitting here with have to have the knowledge to deal with all these folks coming from all different cultures.
I'm going to tell you an interesting fact that I don't think a lot of people know.
Okay.
You may not even know this. I'm not trying to put you on the spot, but I'll just ask you a question. Do you know the day that we have the most instances of domestic violence in this country, the day of the year?
The day of the year? I would say around Monday.
Super Bowl Sunday.
Okay, Super Bowl Sunday. Okay, yes. Okay.
Super Bowl Sunday, when you think about it, what's the main sponsor of the Super Bowl?
That's right.
Beer.
That's right.
Budweiser, usually Budweiser. I'm sorry I don't want to disparage Budweiser, but it's beer.
Beer.
It's alcohol.
Sure. Of course.
People sit at home, they drink, they get overly excited, you know, they're not eating or they're eating too much or whatever. And a lot of times they become abusive towards their family members and their friends. And that is the day that the police usually report the largest number of calls on domestic violence cases. And it's directly related to the amount of alcohol consumed.
Of course, of course.
Alcohol makes some people behave very aggressively.
Oh, sure.
Not everybody.
No.
But some people become very, very aggressive when they drink alcohol.
Surely. Well, I look at the amount of alcohol stores in our communities, and that's definitely related to depression and things like that. People trying to get rid of their depression by
so they drink a depressant, and it makes them more depressed.
More depressed, yes, and it's just a stone's throw from the hospital. So you go and drink, like we used to call it, sneaky Pete, you know, because it sneaks up on you. You know, these wines and things like this. And then we had all these drinks in the stores where these young people could buy across the counter with the caffeine, of course, but with other stimulants along with it, you know, and to stay awake at night to study, even medical students. And so you deal with medical students here as well, do you?
Absolutely. So. Deal with students, I deal with residents, interns.
Yes, right.
Who, excuse me, as you say, have to be awake at odd hours and have to be not just awake, but functioning and focused.
Surely.
A lot of physicians who have access to narcotics in the operating room. We've had some students and some residents who've had problems with fentanyl and you know, some of the other narcotic agents that are used for anesthesia or pain relief.
Surely.
So that's not a small problem. You know, they have access. They know how to use it. They know what it does.
Right.
They can get access to the other drugs which counteract the effects of the narcotics. So one drug will, you know, put you to sleep and help you to relax, then the other one will wake you up again.
Oh, yeah, surely.
You know, and as physicians, even though you say, you know, physicians don't have a great deal of curriculum is not devoted to pharmacology, but still, you know a lot more about pharmacology than the average individual. So physicians, especially anesthesiologists, they have that's the specialty that usually has the largest problem, because they know exactly how much to give to relax you, how much to give to wake you up, and then how to strike that balance. We had a student here, I'm sure you remember, Jennifer Timbrook.
Oh, yes.
I think it was, I want to say 10 years ago. It may even have been more than that. But she was a star student. She was an A student. Everyone loved her. She was always prepared, always scrubbed into the OR. Whenever anybody needed a student to scrub into the OR, Jennifer was always there. And she was found one day dead of an overdose over in the county with a spike in her arm using fentanyl. And we totally missed that. We totally missed all the signs that she needed to be in that OR because that's where the narcotics are.
That's right, yes, yes.
You know? So while we were looking at her being a star student and always being ready and always being willing and able to help with surgery, but really what she was doing was she needed access to those narcotics. I'm not saying that everybody who's a star student is got a problem with narcotics, but it's something that we have to be aware of.
Surely.
It's something that we have to watch out for. We have to know what we're looking at, what the signs and symptoms are in ourselves and in other people. Somebody has a prescription for Darvon, Darvocet, Percocet, whatever.
Surely.
When you go to the dentist, you have a tooth pulled, you get a prescription for Percocet.
Oh, yeah.
That's a narcotic.
Surely, surely.
That's the same. Your body doesn't know the difference between Percocet and heroin.
That's right, of course. You know,
You know?
And these things, you know, I think when medical students get out of medical school, very few of them have had any really good lectures on these kind of things you're talking about. And yet they're going to be facing with that prescription pad in their hand with a license that they can write anything, but at the same time not have the knowledge. I hear you had to go to get a master's in other things, substance abuse and so forth, and yet I found when I was in medical school, I didn't receive any lectures on substance abuse or things like that, you know, and it's going to be part of the whole medication and things that they're taking.
Because I teach also, and I tell one of the things I tell my students, especially if they're going to become teachers or they're going to become physicians, I guarantee, you are going to have, if you're a teacher, you're going to have somebody in your class. If you're a physician, you're going to have a patient who's going to have a problem.
Right.
Guaranteed. That's how common the problem is.
Yes.
So you need to be able to understand what you're looking at. You need to ask the right questions. That's what we tell our students now, and they do get more. They do get more content in the curriculum now about substance abuse than they used to.
Right.
You have to ask the hard questions, just like you do with age, just like you do with sexual activity. You have to ask about drug activity now.
Right, surely.
You have to ask, what are you taking? How much are you drinking? Are you smoking? Are you using marijuana? You know, are you using cocaine? And you have to be honest about the answers.
So, of course. Because these things are so easy to get on the outside now, marijuana particularly when they're legalizing it. How many students are really getting into smoking a joint and things like this, you know, just to maybe stimulate their thought process.
Exactly.
In a sense.
They think that it makes them more able to concentrate.
Able to concentrate, yes, you know. But these are things that are complicated in a hospital. You know, running a hospital, it has so many different varieties of things that are going on with workers here and students and things like this. So your job must be awesome sometimes to have to deal with all of it and be very responsible at the same time, because you're the last person. If something happens, you're going to be the first person they should say, well, so do you work along with a psychologist here at the hospital?
I work with a lot of people. I work with psychologists, with social workers, with treatment professionals, with psychiatrists if necessary. Because some people have legitimate mental health problems. Some people are legitimately depressed. They're legitimate. When I say legitimately, I mean they have the disease of depression. They might be schizophrenic, they might be bipolar, they might have a mood disorder, they might have an anxiety disorder. These are things that are real problems.
Right, sure.
If I have a panic disorder, let's say, I get panic attacks. And I have found that, let's say, before I speak to a large group of people, or before I get on the subway, or before I go to a meeting, I have a panic attack, okay?
Right, sure.
And I have found that if I drink a little bit of alcohol before I do those things, that I'll feel better, I'll be more relaxed, I'll be able to, so I get into a habit of doing that. And before I know it, I'm off to the races. I've got a different kind of problem.
Oh, yeah,
you know?
sure.
So, I deal with people, because sometimes when you take away the alcohol, you take away the drugs, you find out that you have somebody who has who's depressed or who's bipolar.
Yes.
So then we refer them to a psychiatrist. We refer them to a psychologist to do further testing, because sometimes people use drugs to self-medicate.
Oh yes, surely. Well, I can tell you, Lorraine, it's of course again, time is our enemy, and discussing a very important subject, but we're going to have to spend more time at this, I think, because people will get a better understanding when they go to doctors and get these prescriptions and things like this, what they should be considering other than just for pain, but how it might be affecting their personality. So I want to thank you for being with us today.
Thank you, Dr. Deas. Always a pleasure.
And I hope that we can continue this kind of conversation as we go along and pass these tapes that we make here out to medical students to get some more information, because you had to do what you had to do to become the expert that you are. And so you folks out there, when a doctor writes that prescription, it's not for your relative, it's for you. And that doctor knows exactly what other things you're taking, and you do not know what your other relatives are taking when they take that same drug, how it might affect them, or even death. And so therefore, be very careful. All the prescriptions that are outdated on your shelves and things like that, they're not necessary, they're not really needed anymore. It's almost good to, when you go to the doctor, that he has a dispensing thing where he can dispense the drugs for you, because you don't want to throw them down the toilet and you don't want to throw them down the sink, because that's our water supply, and it gets into the water, and you don't want these fish to go around having the same things you have. I hope the next time I see you, we'll just further discuss prescription drugs.